Well, I'm Jeff Thompson again. I'm a pediatrician, and I have a microphone so I can wander around. It makes the videographer earn his keep today. Sorry. And I know something about the heat index and the heat issues in Milwaukee because I played in soccer tournaments there in the middle of the summer, and it's hot, and I'm old, and it about killed me. And so I think it's really true. My approach today, my conversation with you today, is about some work we've done at the Gundersen Health System, and I want to emphasize a little bit about the technical piece of what we accomplished, but more I want to talk to you about how we went about it and why we went about taking on the issues that we took on. First, a little bit about Gundersen. We're an integrated healthcare system, a number of hospitals, clinics. We take care of people in Iowa, Minnesota, and Wisconsin. Fortunately, this year, Wisconsin's basketball teams aren't quite as good as Kentucky's basketball teams, so I'm afraid you'll have a longer run in the tournament. But years change. You never know. I think of great importance, and one of the great leverages that we used was the purpose of our organization. There's a conversation about health and health care. Early on that we said our responsibility is the health and well-being for patients in our communities, and we described well-being and health broadly: the financial health, the social health, the environmental health of our communities. So when we describe it that way as a continuum, it made it easier to have arguments with our board, who may have been a little far behind, and easier with the community to say, we want to be a partner in these activities. So our mission was to distinguish ourselves through excellence, to be able to do this so well that we could compete with anyone in the country, but consistent with our mission. Now, you'd say, why would we want to become involved in this activity of climate change or sustainability as a healthcare organization? Well, the incongruity is a problem. We're supposed to be keeping people healthy, but we're killing them with our pollutants. Children, adults, it is a huge problem. Hospitals are we're 20% of the economy. Healthcare is almost 20% of the economy, and we are more energy utilizing, more energy intensive than commercial buildings and schools and things like that by 2.5 times. So we have a huge impact, and that doesn't even look at the National Health Service in England says that we as healthcare organizations have more than our energy impact. Our technology and our pharmaceuticals have an even greater carbon footprint. So we have a long ways to go. We believed in 2008, 2007, we thought energy prices would continue to rise. Now the natural gas glut has caused a bit of flattening, but we believe eventually it'll rise. And even in that, we thought we could reduce waste in energy and a variety of other things and make money on that. So that was our journey. We didn't set out. Now this is part of the conversation piece. People say, how would you ever sell climate change to your board back in 2007 and 2008 when you got started on this? And I didn't. I didn't. I never mentioned climate change to them because that would have been a fail. Now, if they would have asked me about climate change, I would have said there is better evidence, there's better scientific evidence for climate change than the majority of treatments that we give in our institution. And that's true most places actually all the places in the country. Our outcome's as good as anybody's. There is better evidence, more agreement. You think you can get 97% of all the orthopedic surgeons in the country or all the neonatologists to agree to a certain practice? Not a chance. But if 97% of the scientists say, but that wasn't the discussion. The discussion was, how are we going to decrease pollution that's hurting people? How are we going to use that system to decrease our operating costs? And instead of sending money outside the state, $15 billion leave Wisconsin, how are we going to keep that in the state? We also believed it was an opportunity to find ourselves as an organization to truly live our mission, as opposed to just giving lip service to it. So that's what we thought we could do. Here's one of the inspirations. If you're starting out in this journey, this is a great, the book Natural Capitalism. It talks about ignoring conventional wisdom that it's jobs or the environment, or that being sustainable has to cost you money. It just isn't. It isn't the case. It also continuously reminds us that there's really no way, unless that occasional rocket that goes past Pluto and keeps going, that's probably a way. Everything else, it's staying with us. So I argued to the board as part of our mission, it was a good use of our savings, and I'll expand on this a little bit later, because this is much different thinking than most people think, that we could get a return on our investment. It was certainly safer than the stock market. We had just come through 2008 and 9. The local investment was great PR. We figured we could get partners from the faith community. John Balbus from the National Institute of Health left, but a great friend, and he and I were in Paris. The first people in the community that wanted to talk to me when I got back from the climate talks were the nuns. They absolutely wanted to know. Of course, they wanted to know if I got to hang out with Pope Francis, but they really wanted to know what the real deal was. And this is a piece for going down, and when you're engaging groups, because finances are such a big thing on people's minds, and one of the biggest obstacles to overcome is short-term thinking. Well, so we're a billion-dollar organization. I spent $2 million on conservation. $2 million in conservation in the first 2 years. And I saved $1.2 million every year after. So I don't know about you, but my savings account's not getting a 60% return. And nor is the rest of your money you're investing. Every year I get a 60% return on that money I invested in conservation. So that's an argument you can take to any school. You can take that to any business, any shop, any retail store. You can make those kinds of arguments. The other argument that you can make when you're trying to build coalitions of people is to face the brutal facts. Jim Collins in Good to Great says, face the brutal facts, but never lose hope. We could use that same saying when it comes to our political environment. We have the facts, here are the facts, but we don't have to lose hope because we can still do a lot of things. We looked at our facts. What were we doing at Gundersen, a healthcare organization, trying to keep people healthy? We were putting 435,000 pounds of particulate matter into the air every year. 70 million pounds of CO2. And almost 2.5 pounds of mercury. You say, well, that's not much. 2.5 pounds of mercury? A gram of mercury pollutes hundreds and hundreds of acres. So pounds pollutes tens of thousands of acres of water. Do you know why? If you live in upstate New York and you're a child or a pregnant woman, you can't eat any fish out of most of their lakes? It's because of us in Wisconsin and Kentucky and Illinois. All of our coal debris is sitting in their water, and they don't have many fish in them either. So this is the truth. This is what we're doing. So what do you do? The first thing you do is conservation. I already mentioned the return on the effort. Over this time, we have over 50%. This year it's going to be 59% improvement since 2008. So you don't have to get Congress to pass a law. You don't have to get into a complex generation of energy. What you can do is say, we're going to start conserving. In fact, we set a goal in 2008 to be 100% powered by renewables by 2014. And the key piece of it was to decrease how much energy we were going to use. This is in the face of building a brand new facility, of taking down some old facilities, of regenerating how we provide light in our organization. We had many projects that made sense that pushed us along this way. We also said we generate electricity. This is what pushes it out past many healthcare organizations, certainly down in 2008. But if you look What were our first approaches to getting to energy independence? The first approaches were conservation. And then we did wind and a variety. You'll see a landfill on there, a biogas project with the county. They say, well, you can't work with the government. Actually, the government's made out of a zillion different pieces. Anybody that has the same values and similar goals, you can work with them, even if the cultures are different. They have the same values, you can go for it. Work with the county. There's a landfill, a county landfill. We said if you drop a pipe down to our northern clinic that has 1,200 people on it, we'll buy the gas. You'll buy the gas? Yeah, we'll buy the gas. We built this project, and now the county gets $250,000 a year that they never had before. We heat and power and cool a whole campus on gas from the landfill that was just being flared into the atmosphere, and we save money every single day. Good for the Gundersen, lowering the cost of care. Good for the community, provides a source of income. They don't have to raise their taxes. That's good for the economy. And good for the environment because it's really well contained. And it displaces other energies. In the upper Midwest, coal is a major source of electricity. So we have a number of items you can see on there. The conservation is pretty darn important. Now about financial return, everybody wants to go financial. Conservation I already talked about. The wind farms, it all depends on how big a monopoly you have on wind. The wind companies, the energy companies, you put up a wind turbine, they might pay you 2 cents a kilowatt hour and sell it for 18. That makes it hard on your economics. And so the wind farms, it kind of depends. The landfill biomass is hardwood chips sitting around Wisconsin, rotting on the ground, turning into a variety of bad things. We put that into a very high-tech biomass boiler that has the same pollutant index of cleanest natural gas. But it's all renewable. It supports the local economy. It is not a fossil fuel. We have a geothermal field and a dairy biogas that not only generates electricity and prevents the methane from getting into the atmosphere, but it also prevents phosphorus from going into the lakes, which then results in massive algae blooms. So there's been a variety. Do we have all victories? We didn't have all victory. The brewery is a giant failure. We absolutely failed. We started making electricity off of beer gas, which was great. Making electricity, all the billboards, everybody loved it. And then, some of you guys drink those little things of hard lemonade, Mike's Hard Lemonade, those kind of things with fruit juice, and yeah, you can all leave now because I hate you. It cost me several $1 million. They switched to making that stuff, and they used sulfuric acid to generate it, to clean their vats. And it killed our engine. We had to end up moving our engine. They wouldn't change their method. Here's different thinking. We took some of our savings, instead of leaving in the cash, T-bills, stocks, and bonds like everybody uses it, took 5% out. Over 2008 to 15, our energy infrastructure got a 10 to 12% return, and the other got 5 to 6% return. It's a different level of thinking. There's trillions of stranded assets that are sitting there that could be used for other things. If we would have kept on business as usual, as mentioned, our costs would be up at the top of the blue. We're down at the lower level of the green. And here's our greenhouse gas emissions. We didn't set a goal of 20 or 30 or 60. We set a goal to be energy independent. Now, we have 90 days last year that we were energy independent, but our greenhouse gas emissions are down now over 90%. And we make money on it. And the local economy is boosted by this approach. So you can't tell me it's jobs versus the economy. You can't tell me you can't do this and still make money. People have mentioned the staff pride. Kids coming out of college now, environment and sustainability is part of their value set. It's not a project. It's not a hobby. We're hiring people now because of our program. We have many other successes in decreasing food waste and inspiring the community. I would say this is the summary. We didn't say have the greenest or save the climate. Our pitch to bring in others was it was about health and the economy. But we are doing the other things. Here's our choice. Now I know Jonathan already told us about eating vegetables is a good thing. I don't think being a vegetable is a good thing. So I'm not advocating being a vegetable here. And if you want to learn about how we did this, the mechanics, you can go to our website that's down there. And if you want to learn about the why and how we approach the values and the community, that's in this book that'll come out in a month, 2 weeks to a month, about values-based decision-making, which I think is critical to how we move this forward in communities. Thanks for your attention.